All right, today in the studio, I am chatting with Dr. Jennifer Jones and Dr. Alayna Pagnani from Health Pro Family Chiropractic and Acupuncture. I met Dr. Jennifer originally when I started Wellness for Hugh and have taken several of her Pilates classes at Boost. Yeah. I learned that Dr. Jennifer grew up dancing on the Kilgore Rangerettes, her dream. But after some dance injuries, she integrated physical therapy and went on to graduate from Texas State University with a bachelor's in exercise sports science. From there, she studied at Texas Chiropractic College, and in her final year, had the rare opportunity to intern with Dr. Alayna at Health Pro. Mm-hmm. Fun fact, she loves plants and flowers, and while at Texas Chiropractic, she pioneered her school's beautification project and built their first campus garden. Mm-hmm. Love that. So in summary, Dr. Jennifer can align your spine with both Pilates and chiropractic adjustments and talk all things flowers while doing it.
Literally all day long, every day.
Also here is Dr. Alayna Pagnani, who started Health Pro. She's from the North. She went pre-med and has a bachelor's of science in family studies and human biology. Dr. Alayna also studied at Texas Chiropractic College. During all of her studies, she completed various rotations from helping patients who suffered traumatic brain injuries to recovering addicts to athletes rehabilitating to optimize their performance and more. Over the years, she has gathered quite the stack of recognitions, including to be the second woman to be president of the Texas Chiropractic Association, and she has multiple certifications, including her certifications in pregnancy and pediatric care, which resonates with her true passion in treating pregnant mothers as well as their newborns. Mm-hmm. In her spare time, she loves yoga, Pilates, spending time with her own two boys, and together this duo at Health Pro focuses on preventative care of their patients and hopes to treat the entire family from birth and beyond. So let's get into it. How are y'all feeling?
Thanks, Alexis, for having us.
Yeah, thank you.
Fun.
Yes, I know. It's like my first time to kind of intro two people together. So
it's a mouthful.
Yeah. Y'all are both amazing women, and I'm so happy to have you here. Thanks. I personally got into chiropractic care after kind of a motor vehicle accident, which we'll have to talk more about, and, was going. But now I kind of just keep it up as maintenance because I can feel when I'm getting really stiff, and I'll message Dr. Jennifer and be like, I need to come in. Yep. But I want to hear how y'all got into it. So tell us your story, whoever wants to go first.
Jennifer.
Oh, God. Okay, so I fell into chiropractic. I would say I went initially for physical therapy. That's what I went to school for because of my many injuries. So in the grand scheme, I was going to do physical therapy specifically for dancers. And then in my last month of internship that you do before you graduate, I shadowed a chiropractor, and he was really freaking cool. And I think that also made a difference.
It does.
He was just a cool person. You know what I mean? Anyway, he was like, you should just try chiropractic. And I was like, what? I don't want to be a chiropractor. No, honestly.
Had you ever done it when he said that?
No, I went to the chiropractor a few times, but I didn't get it, honestly. But I will say they did not explain things to me. It was just a very cut and dry, lay on the table, get your e-stim, come get your adjustment, lay on this very old school, stretchy traction table. And then that was, if he explained it to me, I didn't understand it. Gotcha. You know what I mean? But I was also 15 and didn't have the mindset for that. But anyway, shadowed this guy, and he was really cool, and he talked me into just trying it out, going to look at TCC. It's like, all right, I'll give it a go. Went to TCC, fell in love with a few of the professors, one of them being the nutrition. He teaches a few things, but nutrition was my favorite class from him.
Love that.
Dr. Coates, he's very cut dry. And he goes, this is what sealed the deal. He was like, there's a difference between ignorance and stupidity. Ignorance is doing something just not knowing. Stupidity is doing that same thing over and over again. So don't make a stupid decision not coming to TCC. And I was like, I'll see you in the springtime, Dr. Coates. So after that, I was like, whatever, I'll give it a whirl. I'll apply. Let's just see if I get in. 2 weeks later, got accepted, and then made a big life decision of, I think I want to be a chiropractor instead of a PT. And I saw the benefits from the superficial layer, but the more I got into it, the more I fell in love with it. And she has a huge part in it, honestly. What was it, yesterday? I was talking about a patient. I was like, don't you just love chiropractic? Like, I get geeked out on it now. And I go home and tell my fiance, like, listen to this. It's so cool. So yeah, that's how, now I like am in love with chiropractic. At first I was like, what? Huh?
I love that. Yeah. Well, you can
Twice
geek out
this.
the whole episode to share about it.
I plan on it.
Also, when were y'all going to tell me I could have just said TCC? That would have been helpful.
No, we want you to say the whole thing.
The whole thing.
I know.
Their
whole
such a hard
recognition
word
here. I feel like my story is like most. I mean, a lot of people are like, I want to be a doctor. I'm pre-med, right? I shadowed a few different professions, physicians. I shadowed a physiatrist, which is a medical doctor who does rehab, and it's PM&R, so pain management. Because my great uncle went to see her, and she did acupuncture, and she let me like put in some needles and take them out, and the patients were just like had so much relief, and I was like, man, I really want to do this. And then I wanted to be an osteopath, doctor of osteopath, which they do manipulation, and so, but they also do some medicine. So I was like, I have best of both worlds in that sense. But then, I don't know, it just kind of like, I shadowed an osteopath. He never like actually touched his patients. He just practiced medicine, which is fine. But I was like, I don't know if that's quite what I want to do. And so that kind of led me down chiropractic. I was like, well, let me check this out. And I was like, yeah, I think this more aligns with what I wanted to do. I was able to do acupuncture at the same time, have my own practice. So it kind of just all fit. But I will tell you, doing my own like self-discovery and self-work, I grew up, my dad had a very bad accident. He broke his ankle when I was in high school. And from that stemmed chronic regional pain syndrome, or RSD. And he was one of those like pain addicts, you know, on pain medication, passed out, drooling on the couch all the time. And I saw that. I saw how it like can ruin a family, and like, you know, just, I was like, it's not a way to live. And I think subconsciously I didn't want to do that to patients. And I was like, you know what, maybe I don't want to do medicine. And he's doing great now. He got another provider who like got him off all the medicine and stuff. But I mean, that's a real thing when you can like get into a profession where you can heal people with your hands and not need medication. It's so rewarding, and you're just benefiting the entire family, not just the patient, but everyone that they interact with too.
Yeah.
And so that's like why chiropractic is awesome, you know. And now it's like, yeah, okay, we love treating adults, but we want to even treat kids and babies and start it from so young, because that trickle effect, you know, on and on.
I know how tough that is, because my dad has broke his ankle too.
Yeah.
But it's obviously more recently. And, you know, we've really tried to help him get all the different kinds of care, and he's had good.
That's great. And I think now things are different.
Meds and stuff.
Yeah.
So he's had good.
They've come a long way.
Experience
but,
with it.
Yeah,
for sure.
Epidemic,
I know,
right?
but I might have to
like
pick your
that.
brain more on that to see how we can help. His was really bad.
I'm sorry to hear that.
He has a full ankle replacement. So it's tough.
He already
I pray
had
for
it?
him every day. Yeah, he did. Yeah.
Dang.
So you did touch on acupuncture too. Did you end up going to get that degree as well?
So during chiropractic school, I did my acupuncture certification. So as chiropractors, we can do 100 hours and then be certified in acupuncture. So
amazing.
I specifically went to TCC because they said, I mean, one of the many reasons, it's a great school, but they said I could do acupuncture. They had the course. So in try 2, so I was like the first year, they offered it, and I was like, I'm signing up, and they were like, no, you have to be like a second year, and I was like, no, I'm doing it now.
I want this now. I already know. I already stuck needles in people. I'm just kidding. That's so funny.
And then my class was the first class to actually take the board exam, which was so hard.
This is why I
Yeah.
haven't done it yet, because 1, I know how intense it is, but 2, I heard the board exam is worse than just the chiropractic boards, and I'm like, I'll just take the needles out. I'll refer you out.
Well, you know, my fiance is an acupuncturist.
I heard,
board certified. So I mean, he can give you tips if you need.
I haven't
cool
taken
would
the
it be?
test in 12 years either, so it's been a long time since I took the boards, but we do have to do continuing ed hours every year.
What is it, like 16 hours every year? Yeah, that's on top.
4 hours
every
year.
Okay, but still, that's on top of the 36
You
that we
already have to do
that we
for
have to do. That I'm like, Yeah. I don't want to be lazy. I just want to be efficient with my time. And I can just
Gotcha.
refer out.
Yeah, you do a lot of things.
Well, that's why we
You
work
do a lot of
together.
things.
Yeah,
You
that's
know?
why we're
Like,
together.
yeah.
Exactly. It's a good cohesive partnership.
You need a buddy sometimes.
Yeah.
You need a team player.
I have one.
It's like me and Whitney for Wellness for You.
Exactly.
Tag team.
Yes. Yes.
So for the audience who may not know or who's never been, can you just high level describe what is chiropractic care? Like, what does it do for you? Why should you do it?
All the things.
I mean, it does whatever, all the things.
Whatever you
it
need
makes
it
you
to,
like
really.
the healthiest person you can be. I mean, ultimately what we're doing is we're creating motion in the joints. We're decreasing interference on the nervous system, allowing the body to work better. You know, in turn, we see obviously like less pain, better range of motion, like less injury, better immune system. But that's kind of keeping it better
cognitive,
sleep. Yeah.
better like focus, better balance. Like you function better. The analogy I always give, and I feel like this clicks for everyone, especially in Houston. Your spine is like a highway, right? And your brain's trying to communicate with the rest of your body. Body's trying to communicate with the brain. Well, if your spine has just a bunch of traffic jams in it, i.e. misalignments or subluxations, then you can't communicate the way that you're supposed to, brain to body, body to brain. So our job is to go in there, find whatever is misaligned or subluxated and free that space. Not only free it, but continuously get that motion going, because we basically have to retrain your body to not go back to its old ways. So that's why we had to see you time and time again, not just it's not a one and done.
Yeah.
How often, do you typically recommend?
Once you're on maintenance, like once
maintenance.
or twice a month.
Okay.
Yeah, I would say.
I feel like I hit that.
Yeah.
You do, because around that time you're like, I just feel off.
stuff.
Like I feel
Yeah.
like I'm in a funk. I'm waking up tired. I am tripping more, or I just can't focus, or like it's these little tiny things that you don't realize are happening, but you just aren't functioning fully. So then when you do something simple like step off a step wrong, or you turn your head really quick while you're driving or something like that, or you pick up your baby, then you're like, what the heck did I just do to my back? When that's something that has been snowballing all along, and we could have prevented that.
Yeah.
Gotcha.
We're helping regulate the nervous system. So we're getting sympathetic, parasympathetic system in alignment with each other, because a lot of people live in the sympathetic state. They're in that fight or flight. They're always stressed. Their body isn't working optimally, so they're chronically sick, or, whatever the case is, how they're presenting. They're chronically in pain because they have cortisol, which increases stress, the stress hormone,
Inflammation,
and pain,
everything,
inflammation.
yeah.
So we can help get them in that parasympathetic state, so that rest and digest, nice and calm, so then they can their body can function better, optimally.
I love that you connected it to the nervous system, because I don't think a lot of doctors of chiropractic actually describe it like that.
Which is the principle of our...
that
We
I've
just
talked
had
to
this
people,
conversation.
They don't talk about the nervous system, but that's what truly everybody needs, because in our society, everybody's so stressed. And that's probably what manifests a lot of my tension and tightness, as you know.
Oh, it's everybody. Yeah. Because it's the root of everything. I mean, literally, it's the root of the plant. It's just, I can geek out on this all day long, because we just had this conversation about how everyone is finding all of these things to regulate the nervous system. And while they do work, chiropractic is the most effective and efficient way to regulate your nervous system.
We've also been doing this forever. This has been what we've been doing.
This is how it started, honestly. Yeah.
I mean, we're most known for low back pain. The research is out there. We are the best, hands down, at treating low back pain. But I was like, it goes beyond that,
Yeah. So quick girl question, and then I want to come back to the low back pain. So curveball, does it matter what part of your cycle you're in when you come, or can you come at any time?
Oh, you can come anytime.
You can come anytime.
Yeah.
I will say you are a little more flexible, on your period. But that's your body's natural, is it on or right? Kind of before on. It's just your body, prepping for motherhood, or trying to get pregnant basically, and then you don't, but you're just more lax.
Yeah, after.
So you move easier. Let me say that, but it doesn't matter.
It doesn't really matter.
Yeah, it doesn't matter.
There's some women will come in and they're like, my back hurts, but it's their menstrual cycle's coming, or they're having cramps. So you're related. Well, yeah, it's all connected. But getting adjusted again, where decreasing interference on the nervous system. And in turn, a lot of women say, my menstrual cramps went away. My periods are more regular.
Ooh.
Oh my gosh, I haven't been able to get pregnant. I'm pregnant all of a sudden, you know? And it's like, why is that? Well, we didn't do anything to
that area.
Yeah,
or
we're
like,
just making the body work better. And in turn, it works how it's supposed to.
Just
That's
cleared up
amazing.
those traffic jams and got things flowing the way that they're supposed to.
I love that. So it can help get pregnant, which is such a good point. So
Well, we don't want to make that claim.
Yeah, we don't want to
we
say.
don't want to make that claim.
Like,
but we're just going to help your body work better.
so that you
anecdotal.
have a
Anecdotal.
yes. It's just like, oh, look at this. Another benefit
Doing
of
what it's supposed to be
chiropractic.
doing. Yeah.
Well, let's talk about that though, because you guys do see a lot of patients who are pregnant or right after pregnancy and or their children. So can you talk about what are the benefits in those phases? Like,
That's a lot.
yeah, that was like 3 different ones,
Yeah.
but maybe.
You
wanna
want
take on
pregnancy?
pregnancy?
You want to take on pregnancy?
You can take on. I'll take on postpartum.
Okay. Well,
Okay.
okay. Well, it's kind of go.
Okay.
hand in
Well,
hand.
okay. So
Yeah.
pregnancy. All right. So pregnancy, obviously, your body is growing a human, right? You need to function well to do that anyway. Then your body is also going to expand. I hate saying that because it feels like, I'm sorry, but your body's going to expand, i.e. your pelvis and sacrum need to move the most, so that bottom part of your spine. If everything is really restricted and tight there, it's going to be very uncomfortable for you, especially near the end. But 2, it just doesn't make as roomy of a space for baby. So not that we're moving baby or anything like that, but we're just helping the body expand as best and evenly as possible so that mom is more comfortable and then baby can get in an optimal birthing position. Not to mention, sorry, what were you going to say?
Oh, no, I was just going to explain. Like, we specifically do the Webster technique, which is a specific training.
Yeah.
And that is to balance the pelvis. By balancing the pelvis, you decrease, like, interference on the nervous system. You decrease any sort of, like, muscle tension or subluxation. And then, in turn, baby can get in the ideal position for delivery. And if baby's in ideal position, they're not pushing on different things, which is causing pain.
When they flip sometimes, can chiropractic care help them flip back?
So again, all we're doing is balancing the pelvis
Okay.
to create space.
Yeah.
So by creating space,
Whatever
it could.
happens, it
could
definitely could.
It happens a lot.
A lot.
But
The
again,
likelihood of it happening
we're
is
not
higher.
flipping babies.
No.
We're balancing the pelvis. Yeah.
We're flipping pelvises, not babies.
But I
And
do
you
think
the pelvis is like twisted or shifted.
Yeah.
Yeah.
You know, it creates tension or torsion. We need to balance that out. Then once it's time for delivery, those SI joints start to open up. The pubic symphysis starts to open up. And if it's twisted like this and opening this way, I mean, baby's like, I'm getting stuck on something, you know?
Right.
And that's going to create a very long, hard labor. If everything is balanced and opening up how it should be, you can birth in, I birthed in 7 hours.
Oh my gosh.
Yeah.
Okay.
To actually,
I think I feel like more women need to know this, and
Yes.
more doctors need to recommend it.
Yes.
But also, I'll be coming to see y'all in a couple of years.
Yes.
Specifically,
I
for
love
that.
it. Yeah, I love it. It really does make a
Anything
difference.
to make it more comfortable, but also to make it just more seamless during the
it doesn't have
process.
to be this like
And pregnancy doesn't have to suck.
No,
you
it
can
doesn't.
feel
No.
comfortable.
You can-
know?
yes.
I want
You
to
know-
make it awesome.
Actually, one mom recently who just came in, I saw her like when she was 20 weeks maybe. She really didn't have a lot of pain, kind of some discomfort, but she wanted to make sure it stayed that way. Like there wasn't further pain because she knew it could be painful. Like she could just be really uncomfortable the whole time. And who wants to be uncomfortable for 9 months? Like
Right.
It's just, even for 9 days is hell. You know what I mean? Sorry. But not, well, okay. So she had her pregnancy. It was great. She felt wonderful, but her whole like labor was only 7 hours. She
Okay.
pushed for 20 minutes. Baby came out, no problem. Like everything was great. And she's like, I feel fantastic.
Wow. Amazing.
So 2 weeks, I saw her yesterday, 2 weeks postpartum, and she's feeling great. She actually wasn't super out of alignment, and like her body is just recovering really well because she had a really hard workout and basically an injury, if you think about it, and
Yeah.
she's just healing like a champ.
I love that.
Yeah.
So touch on the postpartum.
Yeah.
How does that help?
So, well, you recover a lot quicker. If things are in the right position, then the likelihood of tearing or dislocating your coccyx, your tailbone, needing to have a cesarean, just other interventions or other consequences that could happen from your pelvis not being in alignment because baby can't get through, decreases significantly. Then that makes your care obviously a lot easier if the whole process is a lot smoother. Not to mention you're going to feel a lot better too. So like nervous system wise, you just feel better. So you can not only take care of your baby, but you can take care of yourself, which is still really important as a mom. And I feel like that just gets thrown out the window the minute you have a child, which sucks, honestly.
When you need it most.
Exactly, when you need the help the most. But I think that's the biggest thing, is that it not only allows you to have a smoother labor, which will allow you to have a smoother postpartum, but mentally it just gets you you just feel better in your own skin. Right. You know what I mean?
And of course, if you're helping with the nervous system, you're going to feel a lot calmer because it's a very stressful situation.
Yeah, exactly. Yeah.
The first 6 weeks after you deliver, you still have that relaxin hormone.
Yes.
And so everything is still moving in excess,
it's
just like at the end of pregnancy. And so the pelvis can get really off balance. And then moms, I mean, maybe they were like on their back with their legs up birthing. Maybe they were in a squatting position. Like, who knows? That's putting a lot of extra tension on their hips, their pelvis. Then they go home and then they're sitting like this feeding their baby, right?
Yeah.
And so and then they don't have a core anymore, right? So everything is really weak and loose and it just hurts. And so by getting adjusted postpartum, we're helping to align the spine. So once that relaxin hormone drops after the 6 weeks and everything starts to solidify, it kind of goes back to where it's supposed to be instead of like out of alignment. So let's say, hey, I want, another baby. We're setting them up for success the next go around as well.
Mm-hmm.
Wow.
Yeah. It's just a full cycle. Yeah. We hit all the points.
I know. Sometimes I sit here and I love learning from people and I'm like, I was meant to hear this before. I have my child. Like I was meant to hear this. This is amazing.
So happy.
She's like, I'm getting pregnant on Valentine's Day.
We're like, honey, we'll be just
I'm
fine.
not ready yet, but I am the oldest of the
Can we
siblings.
take credit halfway though? Can we just take a small credit for it?
You and my acupuncture, both of you. So that's about the mom, which gives me so much hope. What about the newborn? Talk about that.
So we always offer a free spinal screening to our patients who've come in for pregnancy. We're like, hey, we want to see your baby. We know that you value chiropractic care, and we want to make sure that we're setting up this baby for optimal health and a great start to life. So birth is very stressful on mom and baby. I mean, there's a lot of birth stress, or as people like to put it, birth trauma. I think that's, a fair term, but it's harsh, And just think that baby is getting squeezed and pushed out. And in a C-section, they put 60 pounds of pressure on their cervical spine, their neck, to pull them out. That's going to create a lot of restrictions in the joints. And so babies might present with, fussiness. They're like, I'm sore, I'm achy, they're hurting, maybe they're favoring one side. All those muscles connect to their jaw and their tongue and their mouth. And so what's baby's job the first few days, right? Latch, eat, eat, sleep, poop, all those things. And if they're uncomfortable or can't do that because there's so much tension, it was it's going to create a lot of stress and, maybe unsuccessful feeding patterns. And so what we can do is really get in and just see if there's any tension. If there's a restriction, we can do a very gentle adjustment to help release that. And then baby is just going to work better. They're going to be happier. They're going to eat better. They're going to poop better. They're going to sleep better, which in turn helps mom feel better because she's not stressed, because baby's thriving.
Yeah, it's all connected.
But, a typical thing that babies will come in for, colic, reflux, torticollis, plagiocephaly, so flathead, latch issues. And again, we're not necessarily treating all those things, right? We're treating the subluxations, and in turn, those things tend to resolve.
Yeah.
Interesting.
We're just helping every puzzle piece sit where it should sit, and then the whole picture is better.
Yeah, I love that.
So we always love to see mom and baby. And that's why we have our family room. I think you probably have seen it. I don't know if you've been in it, but
I've seen it.
It has 2 comfy chairs. It has a PlayStation for the toddlers, because people usually have more than one kid,
Yeah.
you know.
Right.
Or like 5.
And it has
Especially
like
if they've received y'all great care to keep going.
nursing pillows, we have water, we have granola bars, you know.
Aw.
We just like have them stocked so that
Very
everyone can
family-friendly.
get treated, so that everyone can thrive, especially in this like transition period of like motherhood, you know?
That's amazing.
Or familyhood. I mean, dads need care too.
Yeah,
you know?
dads
Yeah,
do
sure.
too. Yes,
They work a
because
lot. Usually.
they have other things that they have to take care of too, and like you said
Heavy
earlier,
lifting,
teamwork. Like
yeah.
you just have to work together as a team, and we just help that team work best.
Yeah, that's amazing. I sort of say, I wish my parents would have taken me when I was little, because we were talking about how I'm pretty sure I'm tongue-tied. Or what's it called?
Yes, a
You
tongue
are.
tie. Yeah, you
Okay.
are.
And I was like, Dr. Jennifer, can you fix this? And she was like, well, you would have had to do that when you were younger, so now it's going to be a little harder. But that's something you guys can spot and help with at the beginning as well to prevent
Absolutely.
from getting worse.
Yes.
Yeah.
Yes.
Okay.
Yeah.
So like, just touch on some things that you're struggling with right now.
I mean,
You're like,
speaking.
oh Jesus.
Okay, so I guess I told you like a little
Yeah,
bit
last time.
of like sinus or congestion on one side. I have like deviated septum, and I think it's sort of related. So it kind of like it's challenging for me to breathe out of one side more than the other. And then neck tightness. I mean, even like deep breaths or
TMJ
stress,
stuff,
TMJ,
yeah.
grinding at night. That's a big one, actually.
Yeah.
Some of I'm trying to think all the ones I told you about, but we were kind of listening through, and we're like, maybe these are all connected.
And then
So-
sure enough, I was like, can you lift your tongue, please?
Yes,
And
and
you're
I'm
like,
aware,
why?
But
But
talk, can you touch on like, so what is a tongue tie? Because this is to me a newer topic, and what's the con of that, and what can we do from early to now?
Well, you're about to give a presentation on this.
Well,
You wanna take this one over?
a tongue tie is basically like extra tissue on the frenulum. It's connected a little further in front.
Okay.
You can also have a posterior tie, but there's more tissue that's like holding the tongue to the bottom of the mouth. In newborns or babies, if we see this, typically they present with like feeding issues because they're not able to move their tongue in the proper like mechanics to like drain the breast properly from breastfeeding.
And or bottle. It's
or
not
bottle,
just,
yeah.
it's not just the breast.
And then the tongue is supposed to be forming the cranium the first year of life. So the tongue's supposed to sit at the top of the mouth. If it's not doing that because it's tied
Being
to the
pulled
floor,
down.
it's not shaping how the rest of the cranial bones come together. So the sphenoid, the frontal, the parietal, all those. Hence your deviated septum, right? If your sphenoid bone is misaligned, it's going to affect how the sinuses come together.
Yeah.
So if we can correct that early on, development will be in the right shape.
And the babies are
Yeah.
a little bit more adjustable.
Pliable, yeah.
Yeah,
I mean,
exactly.
you can like move
The-
and
no,
mold their
they're-
heads. Like
Yeah.
within the first 4 months, you can
Yeah.
get a lot of like movement in there, you know, gentle movement. But I was like, you can sort of like reshape their heads and help them.
Dang.
Yeah.
Yeah. It also is going to connect to the neck muscles, to the base of
Yeah.
the neck. So if the tongue is tight, it's pulling everything forward. Then we get into the fascia, which is that connective tissue that lays over the muscles. The tongue fascia connects all the way to the toe. And so if the tongue is tight, it pulls on everything midline. So we'll find in adult, it translates as chronic neck pain, chronic TMJ pain, you know.
Chronic migraines.
Migraines, or poor posture. I mean, it can even go into like tight pelvic floor because that's
Yeah.
all connected
It
too.
is all connected.
I feel like I have all of that, but
like a
migraines.
tight diaphragm, tight pelvic floor, tight glutes all the time.
Yeah.
It's just a trickle effect
Down.
And you don't know how the body is going to respond. Like
Yeah.
some compensate well, some don't, you know?
Yeah.
And it's probably a matter of like, what other things are you doing to like help yourself, such as like stretching and hydrating and sleeping and, you know, core exercises, posture.
I would say like my symptoms are fairly minor, but
Yeah.
since I have started working more and more on my health, I have more awareness of when things are maybe don't feel right. And so I think just over time I've cultivated the awareness to notice some of these things, and I'm like, it seems a little off, right?
Yeah.
You know, and so, you know, maybe just someone going by day to day wouldn't notice this kind of stuff, but you know, now I kind of gotten down to the root, and I'm like, it's all kind of leading back to the same thing, no matter how much stretching and acupuncture and chiropractic. Yeah,
it's all there,
It's,
you know, so.
It's kind of wild to think like it seems super simple and like pinpoint and almost like over dramatize sometimes, but it's all one. It's just connected all the way down to your big toe, but everything is in sequence with each other. Like your whole body just moves as one unit, not just one thing. Like even me lifting my finger, this muscle is all the way up here. You know, it's just, it's always something that's even deeper. And like you said, you have like minor issues right now, but you do a lot to help mitigate that.
Right.
And you still feel like it's just not,
I just can't get all
like
the
you're
way there.
almost there, but you're not. And that's what we want to help and prevent, you know, like it's not that we're going to make everyone 100% like you're good as gold all the time. I mean, that's our goal, you know what I mean?
Right.
But I think just setting people up for success to live the best life that they could possibly live. That's our main goal. And it just goes past like releasing tension and like helping eating. It's really just helping you, like she said, thrive.
For the rest of your life.
Yeah.
And just because you are noticing it because you're like more aware. A lot of people are just like, that's normal. I'm like, that's common. Not normal.
Yes, that's
well, I'm just
thing.
mind blown. Like, why don't doctors, especially for the pregnancy part, warn moms to look for this?
Have
Is
to
this
do an
not in their
interview with them,
education?
maybe.
Yeah, I think asking.
That's not part of the education. I'm just
No,
confused.
I mean, we would.
I mean,
don't
we
know.
have some
Yeah.
OBs that refer to us,
Yeah,
and they're
we
great.
do.
Midwives, great. I mean, lactation consultants, like there definitely are like wonderful, wonderful providers out there. I didn't go to
I think
medical
it's getting
school.
better.
I
Yeah.
don't know, but what I gather is that it's not in their training, so they have to
Right.
go out and like learn on their own.
Yeah.
You know.
I
But
think
just
it's
like chiropractic, there's
know.
things that aren't in our training that we have to go out
Exactly.
and learn on our own.
It's just
too.
like opening your eyes and
Yeah.
trying to expand your knowledge is really what it is. Which, because I mean, even as chiropractors, like you said, we could just stay baseline, very in a box. Like I'm only going to treat pain, or I'm only going to treat sprain strain, like just the pain. But we realize something is deeper than the pain, and how did you even get to this position or this point? That's why we dug further, and that's why we do what we do.
Right.
Which seems
Yeah.
like,
And I do
Wow.
firmly believe you have to take ownership of your own health. So, you know, you have to ask the questions.
Yeah.
But, you know, my mom maybe didn't know to ask the questions. And so,
I know.
you know, it's
Yeah.
just kind of like sad because I wish the education would have been there back then. You know,
Well, I
but,
think-
you know, she did the best she
yeah.
could.
Right.
Well, and back then, just people
With
just
what she
didn't
knew.
talk about it either.
Right.
Like,
It's becoming
we're just-
more commonplace.
yeah, because people are talking about it and they're not scared to talk about it, and they're not scared to ask, like, okay, well, what other option is there? I feel like within the last probably 10 years, would you say, people have gotten more comfortable with what are my options, or is there another
Standing up for
option, and
themselves,
standing up
yeah.
for, like, I don't feel comfortable with what you just presented me. Is there another way? Where back then people were like, no, this is what it is.
Full
and
trust,
That's
yeah.
just,
Yeah.
that's, even if they didn't trust it, they were like, well, that's just, there is no other way. And maybe there probably wasn't, but now there's so much there's so many options. So
Such a good point.
you can always, like,
So what
figure
can
out
I
a
do
way.
now?
we
Keep
seeing
doing
Dr.
it. Yeah, you
Jennifer,
keep doing
right?
what you're doing, honestly. Like you just keep
acupuncture, right?
you keep doing what you're doing. I mean, like I told you, it's going to be
Yeah.
a lot that you have to do
If
but
I really
that's-
wanted to, I'd need to go get like my jaw
Yeah, it's-
moved
it's one of those things, like-
or wear a guard, right, to expand an expander.
You would
But-
probably, we would have to refer you out to
Yeah.
some like orthodontic
Periodontist,
care. Yeah.
Mm-hmm.
Expander, myofunctional therapist,
Yeah.
which is like a
We did
mouth
talk about
physical
that.
therapist. Yeah.
It would just be a lot
And that-
more.
to
do exercises.
Honestly, would probably be a great start.
Right.
Yeah.
Before you do anything else, they want
Just-
you to like make sure that your muscles are strong.
Yeah.
That includes your tongue. So
Yeah.
might be a good start.
Okay.
Yeah.
No,
Well, you
it's
gave
not always
me a name. Yeah, I remember
Yeah,
you gave
yeah.
me a name.
It's
If
not always like-
anyone is listening and has a tongue tie, first come see Dr. Jennifer and Dr. Alayna, and then they will refer you for more care if it's beyond hope.
I will say we are not scared to like refer out, like work with others and refer where it needs to go. You
Yeah.
know what I mean? Like
Right.
instances like that.
Yeah.
Yeah.
Okay, so we covered pregnant, postpartum, baby, tongue ties. I do want to circle back to kind of how I even found out about acupuncture, which was a motor vehicle accident, because I think that's how a lot of people find chiropractic care.
Yeah.
Like no one, like until that happened, like no one had been like, go to the chiropractor.
Yeah.
Until that happened to me. So if you're in an accident, and it knocks your spine out of alignment.
It will.
Which,
not if, it will.
True.
For sure.
Case in point. So when it does, it sounds like it is good to come. Tell us, like, is it good to come right after? Should we wait? Should we not? How long should we come for? I just kind of want the general, like, feedback.
I mean,
Well, I think it's patient dependent.
Yeah.
How severe was the accident? What are your symptoms? What are you feeling?
Okay.
I always recommend if you were in any sort of accident, even if it was a little fender bender where you were tapped and there's not even any like damage you can see, you still suffer some sort of trauma, whiplash, sprain, strain. So you should go see your chiropractor as soon as you can get in. And then they can make a customized treatment plan for you. You know, whether that be you need an adjustment or two, or like, man, we need to see you for a few weeks, or we need to see you for a few months, depending on like how severe the accident is.
Okay.
Even like no matter what kind of accident you were in, you're still going to be stressed out and you're going to be worked up, and it's just going to be a stressful experience. So just having that regulation of the nervous system too, and also just having someone else to talk to, be like, you're okay.
Yeah.
It's going to be okay. Instead of, I don't know, just the cop that maybe helped you.
Yeah.
Love them. But, I think it's also just reassuring and helps you be like, okay, I'll be fine. But if it's something more serious, then
please go to the ER too if you need to.
Get your MRIs.
Don't come to us with a broken femur and be like, help me.
Can you pop that back in place?
Or if your finger's going this way, like, no.
But I feel like you probably can. Like, if someone pops their shoulder out of place, can you pop it back in? Is that a thing?
It's not.
No, I don't want to. I'd rather not.
We'll probably
personally
want you to have some medication.
Yeah, because it's just not.
It's not
I'm not gonna lie.
Yeah.
I'm not that fast and I'm not that strong, and that takes a very quick, fast person that's
more for the
experienced.
orthopedics.
Yeah,
Yeah.
Okay.
Like they got to do that all the time
Yeah.
to know. Yeah, it's not just a simple like boop.
The other thing is, like, whiplash can sort of creep up on you. People are like, I felt fine. The next day, they're like, I feel fine. And then later that week, they're like, my back hurts so bad, or my neck hurts so bad. And that's very typical of, like, the pattern where you, like, I mean, you're getting better, but you have good days and bad days. And they just kind of go up and down, up and down. And so, we recommend we're going to follow up with you pretty frequently until you have more good days. Where we're like, okay, you're not complaining, you're not really hurting, like your adjustments are going well, you're holding your adjustments, things seem to be looser, let's like start to space out your visits.
And I have been in a couple, and I agree. I think sometimes with the adrenaline, you might think you're fine.
Yeah.
But a couple days later, you don't feel so fine. And so, like, the second or third accident that I had, again, I've been, like, rear-ended, and I've been T-boned. I don't know why.
Bless your heart. Jeez.
Prayers. But, yeah, so, like, after it happened once or twice, I was like, I need to go see my chiropractor. Like, I didn't want to wait because I knew it might creep up. And I'd rather seek out help early and be preventative after that.
Yeah.
So
It also has a cumulative effect.
It
Every
does.
accident,
Yeah.
your body remembers that
trauma.
experience and the trauma. It holds on to that, and it will just build and build and build. So, by your fifth accident, it was like no big deal, but you're in the most amount of pain that you've been in because you never got care for the other ones.
Yeah.
the joy of living in the fourth largest city.
Yep.
With a lot of traffic.
We love it.
And
Even if you're not,
drivers.
I will say, even if you're not in a wreck, you're stressed out to no end, and like just sitting in traffic or dealing with the people that decide to like,
I mean,
on a
probably
whim
like
get over
slamming
it.
on your brakes is whiplash enough sometimes.
Seriously,
like,
or the cars that just slam on the brake for you,
my
and you're
gosh,
like, oh, okay, here we
Yeah,
are.
exactly. Seriously, I'm like, whoa, I didn't think it was that close, but okay.
Yeah, that's happened a few times. I think I've gotten whiplash just for my automatic brake, deciding we're stopping now.
Oh my gosh, that's crazy.
We also are comedians too.
I'm like laughing because it's true. It's literally so true. So I and I wanted to bring up the motor vehicle accident too, because I feel like, a couple years ago, people just thought of chiropractors as quacks. Like, that's a word, right?
Oh,
like,
they still do.
Until
For
you
sure.
go to a motor vehicle accident and everyone's like, yeah, go see a chiropractor. And you're like, so everyone over here in group A is like, they're a quack. And then the other people over here are like, oh, now go see them. And I'm like, what
Try
is
being a pediatric
happening?
chiropractor.
Oh,
We're
yeah.
like,
Pediatric
really
prenatal.
not.
They're like, you're doing bad juju. None of that.
There's like camps.
But, I meant to say this earlier.
Yeah.
All of the adjustments for the babies and mom or pregnant pregnancy are super gentle, and there is absolutely no twisting or twerking.
Yeah,
like
there is no popping.
I think,
happening.
not
Okay,
unless
good to know, yeah.
for the moms, I will like pregnancy. We could adjust your neck just to help increase that parasympathetic state. But if you don't want it, that's not our main goal. It's to balance the pelvis and sacrum. So yeah, there's no like, that's not our goal. It's never our goal to hear the pops or clicks either. That's just a fun thing that happens.
It's kind of satisfying.
Yeah, it is. Yeah, like I don't know.
fair.
Like when you
Yeah,
pop
'cause
bubble wrap,
yeah.
you know, you're like, oh yes.
Sometimes when you do one side, mine doesn't pop, but you do the other side, it does. So it
Exactly.
doesn't happen
But it
every
still
time.
moves regardless.
The goal is getting motion.
Yes.
And
no
explain
matter
how
what.
sometimes, like I told you, after like the week or two after, sometimes I'll feel little pops too. And you said that's
Yes.
because it's trying to move back into place,
Yes,
right?
that's your spine. That's the self-adjusting that we like when your body realizes, wait a minute, I'm not where I need to be. Let me move. Or, oh, this one isn't moving. Let's move with the rest of the body. It's not that forceful, like, oh my gosh, I'm in so much pain. Let me just throw my body around. You know, it's you're naturally doing what you do, and your body is accommodating and just
Self-adjusting.
working. Yeah, self-adjusting the way that it's supposed
That's
to.
so cool. That's what I love
Yeah.
about the body. Like it's really resilient and it can
Yes.
go
It-
back.
That's why
It
we
knows
say-
what to do
it
if
really
we give it the
does.
right tools.
That's
I
why
mean,
we say
we gotta trust it.
we
Yeah.
just train your body to do what it's naturally meant to do, what it's already going to do. We just help train it.
Yeah.
That's it.
I love that.
We don't recommend self-adjusting though.
No.
All these people out there popping their own necks.
No.
Don't do that.
Yeah,
And
I
half the
don't
time
do
when
that,
you do that,
really.
you're moving the joint that like is always going to move. It's like a swinging door. It's the one that's above or below that's like, hey, we're stuck, and moving this one is not going to help. You might get that temporary like, okay, I feel better because you release some gas in the joint and there's pressure release, but you're still not going to have like the optimal range of motion and function that you need.
that a true chiropractic care can give you.
Exactly, because we are very specific.
So now that
in
we've
what we do.
dived deep into the chiropractic, can you, Dr. Alayna, tell us about the vision for Health Pro? So when did you open it? Because I can't remember.
It'll be 12 years.
Wow.
April 2nd.
Okay.
Yep.
Who?
Yeah, what
It's a
was the
big-
vision?
Big deal.
You know, the beginning was honestly the beginning. I wanted to
It's
do
hard to start a
corporate
business, yeah.
chiropractic. Our
Oh,
goal was to
okay.
like go into companies and like be their corporate chiropractor. I'm glad that didn't work out because I don't think I would have enjoyed that as much. But then, you know, we opened in like a small, like 3-room building and then just grew from there, you know. And right out of school, I knew I wanted to do like pregnancy. My mom's a labor and delivery nurse, and I think that kind of influenced like me wanting to work with like pregnant women. She taught hypnobirthing, and I was like, yeah, I think this is the direction. So I went and took the Webster course. Saw a lot of moms. I had an OB referring to me all the time because I was like the only chiro in the area that did Webster. And then the moms were like, hey, I heard chiropractic care can help babies. And I was like, yeah, of course it can. So they started bringing me their babies, and I was like, this is so awesome, but like I really should learn something more, you know?
Yeah,
I did my pediatric certification, which is 2 years, and a board
lot.
exam. And then I had my own kids like during this time.
Perfect timing.
And so
Yeah.
I think it just morphed into like, this is really what my calling was and what I was meant to do. And I'm so passionate about it. And, you know, then I had the office, we just grew from there. We had like 7 rooms, and then we transitioned one of the rehab rooms into like a family room, and then we made like a nursing, feeding, changing room, and then we used to have like stuff for the kids, and then I renovated my office last year, and now it's what it is today. And
It's
so
beautiful.
the
Yeah.
goal is to help as many families as we can in the Houston area. I mean, ideally, I would love every person to be under chiropractic
Yeah.
care. That's probably not realistic, but if we can see even a third or half of those people, like we're just gonna make it
gonna make a big
healthier
difference.
society.
Yeah.
You know?
Oh yeah.
And yeah, of course it's a business, but really the business comes into like helping people and like helping them just thrive and like live better lives. And it's just such a rewarding like profession and career. And I'm so happy to have Dr. Jones with me. I mean, she was my intern in 2020, and I was like, work for me,
Been a
work for me, work for me,
long
work for
time
me.
coming.
And then
Oh, girl, I wanted to.
finally it worked
It
out.
just didn't.
So,
Yeah. Finally, it all worked out.
but it's
'cause-
nice having another provider in the office who's so passionate about chiropractic care and helping people and helping the specific patient population. You know, it's not everyone wants to see families, right? It's nice to like have a space where like families can come in and they're like, man, I feel like you really catered to us. You know, we have parking spots out front. We have snacks for the kids. Judith's really awesome about like coloring sheets, and she holds the babies all the time.
Yeah,
you know,
she
like,
does.
yeah.
Yeah, just where everyone can get taken care of. And
if they need to like stay and feed their baby, we have a separate room that's private, and like you can hang out here all day. I mean,
even
we do have to
changing
close at
tables.
some- yeah.
Yeah.
So the vision is just a massive family practice where we need more providers because we're seeing so many people, because everyone knows and values chiropractic care.
Yeah.
Amazing. Isn't it incredible when you look back and how the universe led you down your path,
Yeah.
and now it all makes sense because you truly do look so passionate about it. And had you gone the other way, we wouldn't be here today.
Yeah.
And I'd probably be jobless. Honestly, no. I wouldn't have shadowed you, and who knows, I'd be doing sports probably, or just like general care, which isn't, that's
good.
That's cool. I do enjoy that, but this is like,
Yeah, talk a little
Definitely
bit
a
about how
calling.
Pilates complements this
I love
profession.
Pilates.
I love Pilates too.
Yeah, we
all
both
love
love
I think we
Pilates.
all
We're
love
like, hey,
Pilates.
do we have time to go to Pilates
I
class
know.
today?
When I
What are you
came
doing
in
at
one day
lunchtime? Going to Pilates.
well, I was there for treatment, but then I wanted to meet you before the episode, and she was like, "Oh, she went to Pilates." I was
Yeah,
like,
no, that's like,
can't blame her for that. I mean,
it's like a first priority for us.
Yeah, she was like-
honestly. Like, that interferes with the Pilates schedule. No.
They're like, can we do a lunch? I'm like, no.
no, gotta
Gonna
go to
miss our
Pilates.
12 o'clock Pilates.
I really want to
no.
come on Friday. Don't let me forget. I love coming to you on
Yes.
Fridays. That's my favorite day. But I might start coming Mondays too to like kick the week off.
Heck yeah.
Oh, dear
It's in
God.
Westview.
But after sitting at work all week with bad posture, the Friday is really helpful.
Yes.
Like
I
realign my
might-
spine in Pilates, please.
Yes, it's another great way. Well, okay, hold on. For your office too, though, and I don't think maybe you do realize this a little bit, but it's also great isn't even a good word for this. Just a freaking awesome place to learn too. And you harvest such a good learning environment. And maybe I'm the only one that's going to say that, but I wouldn't have learned as much as I did just outside of chiropractic, but like from a business standpoint and how to manage being a mom, being a business owner, and being a provider. If it weren't from her, you're going to get... So it's just, and I think that's what also the office says, is that we can harvest just a good learning environment for all things to help inspire that geeky love for chiropractic, because we need more chiropractors like that in whatever profession they do, like, or niche that they do in chiropractic. You gotta love it, you gotta be like, this is just freaking cool, and I love what I do. Yeah.
Amazing. Oh, that was the sweetest.
You're gonna get
I was like, back to your Pilates. How does it help with chiropractic?
Pilates. So I honestly, in all the rehab that people give to like physical therapists and everything, it's all Pilates based. Like it's all in one way, form, or fashion, it's going to be a Pilates movement. That's your like basic intro to any kind of movement, is to do something along the lines of Pilates. You can get higher in strength training with that, and it's still good to have a Pilates background, because you're going to build like off a squat to just doing a lying leg press, not an incline leg press, just lying down and pressing on the foot bar. Then we can slowly increase that incline. We can do some stability work. We can have it assisted, then have it not assisted. Then we can really challenge your balance and do it elevated. Like, there's so many different things that you can do with Pilates that look really simple, but it's very challenging, and it's all low impact, which is amazing for the joints. So anyone at any age can do it. You don't even have to have a reformer. They're fun. Don't get me wrong.
Yeah.
And they're great. But you
not
don't even
Pilates
have
too.
to, exactly. You don't even have to have a reformer to get a good Pilates workout. And like I said, it's low impact, and anyone can do
strengthen
it.
the core.
Yeah,
It's
exactly.
gonna help
Anyone.
your back.
It's it strengthens really you get your whole balance, right? You're learning how to balance yourself and how to move slow. So you're getting that eccentric training, which is the best way to strengthen your muscles, how to lengthen out or strengthen your muscles in their most lengthened state and control that movement, which is something that not a lot of people have. They just power through things, which is cool. But, if you're like a jumper or sprinter or something like that, then yeah, do that. But even football players, to get that explosive movement, they're still going to have some eccentric loading to go into that powerful movement. So, I could go on and on about this, but that's how you're going to train during Pilates. Not to mention your core is going to be hella strong. Like there's no way around it. And you're going to learn how to engage your core in every single movement.
Yeah.
Not just with ab movements, because you need your core with everything. If you have a strong core, then you have a strong spine, because your core is like, it's just hugging your spine all day long. And then your low back isn't like, I'm doing too much work, you know?
Yeah.
So,
I'm
yeah,
so
that's how.
fascinated by Pilates. I love it.
And
The yogi in me loves it. I wish I could get all the trainings.
Yeah, it's just, I
more
love
time in the day.
Pilates too. Plus being a dancer.
Yeah.
Joseph Pilates actually designed it as rehab for ballet dancers. So that's another, I've been doing Pilates for a while, but I didn't appreciate it like I do now until when I got old. I'm kidding.
Until everything made sense together.
Yeah, until my body started to hurt, and I was like, wait a minute, I should do something else about this. Yeah.
I love that. So that's, Pilates is, you know, a movement lifestyle thing that people can do to complement their chiropractic care. Are there other, you know, like nutrition or lifestyle things people can do?
Yes.
Yes.
Lots.
What's some
Lots
things we
of
can take
it.
home?
Okay, we're going to give you some easy ones.
Yeah,
Yeah.
give me some like rapid fire, and we can always have you back on.
Walking outside.
Yeah. That's good.
That's
even
a-
barefoot, even
yeah,
better, right?
walking
Even better.
barefoot.
I mean, drinking water, maybe with some electrolytes.
Yeah.
You know?
Taking some good quality supplements,
Supplement.
like
And
good quality.
We love our supplements at Health Pro, and we have like the best line in my opinion, but we can get you on the right ones if someone
Amazing.
needs like supplements. But I mean, okay, my go-to, like every person should be on these supplements. It would be a multi, a vitamin D with K, an omega, and a probiotic. And then we can add in other ones. But it's like our food right now is crap. I mean, unless you're growing it yourself, even that, like our soil's crap. I was like,
crap,
everything's crap. So we're not
Not to
getting
be Debbie Downers.
the nutrition and the nutrients that we need. So we have to supplement. And, you know, I know supplements, they're like, people are overdoing it. I'm like, we almost have to at this point, right?
the food's just not what it used to be, and the soil's not what it used to be.
Yeah.
But that's a
mean,
whole other
maybe
podcast.
medicine-
I'm a big
in 5 minutes a
proponent
day.
of supplements too, but
Yeah.
since the supplement industry isn't regulated, you still
Yes.
need to look for quality, and I don't
That's
think a
it,
lot of
yes.
people realize that. They'll just go to the drugstore and grab whatever.
Oh my gosh.
And
Whenever
so
we ask,
quality
we're like,
matters.
Where'd you get your supplements? Or like, you know, the grocery store. I'm like, okay, well, let's
The yellow
work on
top at
that.
H-E-B?
Yeah.
Good point. Good point.
Yeah.
Okay.
So you want to go to a provider that you trust, who's done the research, who knows, you know, quality supplements. But I will tell you, from personal experience of us taking our own products, we're like, this one is legit.
Like there's
This
2 of
one's-
them I
yeah.
can't live. No, 3 of them I can't live without.
Is
like
it a specific brand?
Orthomolecular.
Okay.
I can't even.
Interesting. I've never heard this brand. Okay, I'm gonna look
Well, and
into
you
it.
can't get it in the stores. You can't get it online.
Yeah.
You can only get it like from providers.
Yeah.
Okay.
But it's very regulated. They're
Like,
the top
super-
of the line.
Yes, and they're very nitpicky on where they get their
Nutrition.
nutrition,
Yeah.
but where they get their ingredients from. That's what I was trying to say.
Yeah.
Like it's not just gonna come from wherever.
Yeah.
You know what I mean?
A big thing I've personally been working on in my family, which I've done, is the plastic. We already don't have like non-stick cooking. We have like stainless steel. I have glass Tupperware. She sees that. I drink out of a mug in the office. But I
Cat
found
mug specifically. A cat mug.
that I at nighttime would just leave a plastic water bottle by my bed in case I got thirsty. And I have the reverse osmosis in my house. And I was like, Alayna,
yeah.
just grab a glass. I mean, it's an extra step because I have a townhouse, so I have to go up and down, you know? But I'm like, and my kids, I got the metal water bottles. I'm like, we're not doing the plastic water bottles, period, at all anymore.
Yeah.
So that's a big thing is like limit outside toxins. And I feel like plastic stuff is in everything. And an easy way is like get glassware, you know?
Yeah, I just fill up a glass and take it to my nightstand so I can drink it in the morning. But then I usually like refresh it as soon as I like am functioning.
Yeah.
I'll get like fresh water. I know. We try to use all glass at home, and at work they have like plastic water bottles, and it just hurts my soul. But they have installed
Like
the
a
refillable
refill?
stations now, so if you bring your own,
That's great.
I'm like, thank goodness for the refill.
As we have our
fillable
Stanleys
filters.
here,
Yes.
you know, like,
Get
Can't live
the
without my adult
the
sippy
biggest
cup.
water bottle
That's
ever.
really what it is.
An adult sippy cup.
It is.
We couldn't say, you know, to be your healthiest, you have to get adjusted regularly, right? I mean,
It's true. It's not a one and done. I've told people this multiple times. Like, we're not Jesus. We can't heal you in one visit. That'd be cool.
That would be
But that's not the case. And like you said, you've noticed now, like when things feel out like funky and you need another adjustment. a lot of people think like, oh, once you go once, you always got to go again. Well, yeah, because you realize how good you can feel and like how
true.
much better you don't go to the gym once and come out looking like Beyonce or somebody. You know what I mean? Like it takes some work and it takes commitment and it takes like committing to yourself to just be better. And it's really not that hard. Like if you once a month, just take care of yourself. Just like filling up with gas.
Yep.
Or, you know.
And movement. People need to move more.
Movement is like.
Sitting is so bad. I mean, I'm like every 30 minutes, get up. If you're in an office, like get up and walk around. Yeah.
Well, I know we need to get up soon. So
even just well, I was going to say even just like standing or something. Right now, that's why I keep moving. But even people that are like, I have a stand desk. I'm fine. But like you're standing there like this all day or like this or whatever. Like you just break the mold that you've been in for the last 15 to 20 minutes and just move. Get the blood flowing, get the nerves flowing, like everything. Just get it moving.
So exciting. We're putting an all-sit stand desk at our office, so I'm super excited.
Oh, that's going to be nice.
So last question so we can get up and get moving is what does wellness mean to y'all?
Everything we just said.
All the things.
Living your best life.
Living your best life.
Yeah, I mean, whatever that means to you. You know, if wellness to you is like at my ideal weight and I am eating mostly good meals, but I still like to have some fun on, you know, some days, but I overall feel good, great. Then that's good. So,
I would say having a strong mind-body connection and knowing what your body needs, what to give it, just like knowing what you need.
At least listening.
And, just listening to your body and nourishing it with what it needs, so that you can live your best life. That's how you're well.
Amazing. Well, where can we find y'all?
Behind the big Porsche dealership off of 59.
4101 Greenbrier.
Yeah. Sweet
We're
135.
like in the Rice area, 59 in Greenbrier, right behind that building behind Porsche. We're on the first floor.
Right off the highway, easy to get to.
Super easy. Ample parking. There's not
We have
an issue with parking.
Designated spot.
Yeah, we do have
I didn't know
designated
that,
spots.
but I always can just find a spot. Yeah. I'll look for them next time. And what's the website? What's the Instagram?
healthprochiro.com. Instagram is at healthprochiro. And then
yours is just at Dr. Alayna Pagnani.
Yeah, at Dr. Alayna Pagnani.
Mine is Dr. J. Jones. I have to really think about these things. Like when people ask for the phone number, I'm like,
the phone number is 281-506-0105.
Wow. Okay.
Don't ask me any numbers.
You know the fax number?
Dr. Alayna knows it. Like, who really knows phone numbers anymore with their cell phones?
I know my mom's from like way back in the day.
And you encourage people to book online because they can go ahead and fill out waivers online and all that, right?
Yeah, I mean,
but
you
if they
can
have questions, they can call.
do it online.
Okay.
Judith is so fabulous. She's our office manager, and I mean, you're just going to love her if you call, but she can answer all your questions and help you get an appointment if you want to schedule. And we can get you in usually like within the week.
Yeah.
So
Amazing.
She can work some magic.
Yeah.
She like wiggles things around.
Yeah.
Well, thank you, ladies, for dropping all the knowledge and for being our first chiropractors on. Yeah. That was so great. Thank you for helping me with my health and for helping the community. And we're gonna be together, like mom, daughter, son. Yeah. For my life and on.
All of them. And then some twins at the end just to round it out.
No, you can have the twins.
No.
Thank you so much. I'll see y'all soon.
Thank you.
Thanks.
Bye.